My name's Don Fritz. I live in Ennis, Texas. I retired from the Marine Corps in 1988, and I've retired from the city of Lancaster, and I retired on Social Security. I just had the SI fusion on both the right and left side. Prior to that, I could not mow my lawn without my leg going numb, and I'd have to end up dragging it back to put the equipment up, and now I can mow my lawn and still go do things I need to do. Prior to having my SI fusions, getting groceries was a real hassle. I couldn't go and do all my grocery shopping. I could go and do part of my grocery shopping, and then the next day I'd have to go do a little more. Now I can go through the I can even go through Walmart all the way around it and have absolutely no pain. I think it was about the third time Dr. Creighton saw me, then I started injections. After I'd had 3 or 4 injections, which only lasted anywhere from 2 weeks to a month, Dr. Creighton started talking to me about the SI fusion.
I'm Dr. Christopher Creighton. I'm with Texas Pain Physicians, and I've been with that group almost 2 years now, and have been in pain management practice for 33, almost 34 years. Pain in the sacroiliac joint can come about for a number of reasons, usually involving some trauma to the joint. Sources of trauma include obvious things like falls and rear-end collisions and cars. To treat the joint, we usually start with injections of the joint. We limit ourselves to up to 3 of those joints, by which time we figured that is not going to provide long-term relief if it does not. Over 90% of people get adequate relief from those injections, and we stop with that. So the surgical technique for this procedure is fairly straightforward. It involves first identifying the location of the joint under fluoroscopy, which is like X-ray on a TV screen. Once you identify that, you make a small incision and place a K-wire, which is a stiff wire, into the joint, and then 2 sets of dilators to spread the soft tissue apart down to the joint. At that point, you can run a drill into the joint, which makes a small hole the size of the dowel that you're going to place in the joint, and rasp that out, which roughens the surface of the bone and stimulates the growth of your own bone cells into the peg, as we mentioned earlier. Following that, we take those instruments out except for the dilator, put the peg in, and pull the dilator and the placement instrument out, and we're done.
After the surgery, I came back a week after, and my only restriction then was don't bend over. So I'm really looking forward to being able to do the things I want to do. I like to walk also, and I couldn't. It's been years and years I couldn't walk. Now I can, and it's really, for an old man, we don't have too many options anymore, and I've only got a few more years in the field, so I'm going to take them.
So I've been using the Genesys Spine system for quite some time now, and it is one of the very few, if not the only tool that I have to treat pain for which I can say the results have been 100% so far. We've had no treatment failures, and to me it's very odd when I have a patient that I have to do both sides on. We have to wait about 3 to 4 weeks in between procedures, and I've had patients come in for their follow-up visits begging for me to do the other side, and I've never had anybody beg for surgery before. So that reflects really well on the success of this procedure for patients. It truly increases their ability to participate in normal daily activities.
I would highly recommend this to anyone that's having numbness in their legs and that sciatic nerve is a problem. Man, this is the best thing I've done since having my knees replaced. I like to hunt and fish. I can't dance, so this is not going to do me a whole lot of good that way, but boy, can I mow my lawn now. And I don't have any pain when I'm done. Hopefully, hunting and fishing this fall goes good too. And just in general, when I go visit my daughter in Wiley, I'll be able to play with my grandkids again. And I haven't been able to do that for the last few years. So they're at the age now, the little ones, that they're fun. I need to be able to play with them, and I think I'll be able to now. It's just a great system. I mean, to be able to walk again is awesome.